Awesome. Thank you, Patricia. Hello and welcome, everyone. My name is Caleb, and I'm a program specialist with the TASC team at the National Rural Health Resource Center. Today is Tuesday, September 13th, and we are here for our fiscal year 21 Flex Wrap-Up webinar, where we will review the results of the FY20 2020 Performance Improvement Management System, or PIMS, data collection. We'll understand the requirements and discover resources available for the upcoming submissions, and there will be an opportunity for questions. Today we have Laura Seifert, our Flex Program Coordinator from the Federal Office of Rural Health Policy, as well as Bria Haley, Lead Grants Management Specialist from the Federal Office of Rural Health Policy. I will get my screen shared and let Laura take it away.
Thank you so much, Caleb, and thank you to everyone for joining us today. We have a lot of information to cover, and I know this is going to seem a little bit overwhelming, but I promise you we are here to answer questions. All of this information will be emailed out to you. We've got more instructions that are going to be coming later. Caleb, I think your screen is zoomed in a little bit, at least on my end. That's perfect. Okay. So we are going to dive right in with all of our reporting requirements for the end of the year. And then in just a little bit, I'm going to turn it over to our lead grants management specialist, Bria, who's going to talk about the FFR and the federal financial report. I want to stress this. I know this is going to be a lot of information. Please do not panic and get overwhelmed. This is the same requirements that we have every year. I know we have a lot of brand new Flex coordinators here this year, so everyone welcome. Your project officers are here to answer any questions you have. You're going to get lots of emails from me with more instructions and more information as the time comes. And we're here to support you whatever you need. And for those of you who have been with us for a while, please feel free to chime in on the chat box and answer some questions. You may hear some new information that you haven't known before. So just everybody pay attention and we'll go ahead and dive right in. If you want to go to the next slide, Caleb. So here's our brief agenda for today. We're going to go over some results from the PIMS that you reported for FY20, and then talk about how to collect PIMS for FY21. We're going to talk about the end of year report along with the EMS supplement report for those of you who have it. And then I'm going to kick it to Bria, and then we'll talk about carryover requests at the end. Next slide. So for many of you, especially those of you who are new Flex coordinators, you may have this question of what is PIMS? So PIMS stands for our Performance Improvement Measurement System. And every grant, cooperative agreement, everything that comes out of FORHP is required to report performance improvement measurement measures. So this helps us identify what our future baselines might be. We can track our trends, see how our improvement is going, what our best practices might be. We also send all of that information over to TASC and ARKITA so that they can help inform their TA development. FMT looks at all of this so they can kind of help with our best practices and in-depth analysis. And in a lot of cases, this does inform our senior leadership here at HRSA, at HHS, and in Congress to show the impact of the Flex program. And you all know, as well as I know, the Flex program is doing a lot of really wonderful things. So this PIMS reporting is a great tool for us to be able to show what we're doing. Next slide. So the first thing, go ahead to the next slide, Caleb, is our results from FY20. And you might be wondering, well, this seems a little bit weird, FY20, when it's already September of 2022, this is 2 years old. Well, this is how we all know there's a little bit of a data lag, right? So the PIMS that you're about to start reporting that is open right now in EHB that is due at the end of October is for FY21, the grant year that we just finished. So these are the results from last year that you all reported. And you can see we have this breakdown right here of activity categories. This is the number of states that are working in each Flex program area, right? So 1.1 through 1.4 and 2.1, those are the required numbers. All 45 states are participating in those. And here you can see the breakdown of all of the other program areas between the rest of quality improvement, financial, population health, EMS, and innovative model development, and how many states are participating in those areas. Next slide. So we just kind of cherry picked a few measures here. We're not going to go through all of them, every single program area, because we've got a lot and we have other things we need to talk about. But we just cherry picked a few so you can kind of see what the differences are between what we're measuring in PIMS, right? So for anyone who's filled this out before, you're measuring both how many hospitals are participating in your activities and the hospitals that are improving. So you can see it here, these blue bars are all of our CODs that are participating in core measures of quality improvement in MBQuip, those 4 areas that everybody is required to participate in. And those numbers are great. This is the MBQuip measures are our strongest measures that we report back to Congress. And you can see those red bars are the ones that are measuring improvement. So overall, right now, it looks like our trend lines are going down a little bit, but if you notice, part of that is FY20, right? That was when COVID hit. So we know that a lot of those things might impact, COVID might impact a lot of our improvement measures. Next slide. But you can also see that we've got our additional quality improvement measures that people are also participating in. So these are just some good ways that you can see what we measure and what we pick out so that we can send this up to our senior leadership. Next slide. So we have here, for example, operational improvement. So not everybody is required to participate in activity 2.4, but you can see over the years from FY15 all the way across to FY20, we're steadily increasing the number of hospitals that are participating in activities involving operational improvement, right? We are also steadily improving, especially between FY19 and FY20. That's a really big jump in hospitals that are showing improvement, right? And this is a great thing for us to see that you all are reporting back to us that your flex programs are working, the dollars that we're giving you are working, and we're seeing improvement in these hospitals. Next slide. Here's just another one. We have, this is area 3.1, right? The population health improvement. So this is your statewide population health needs assessment. So you can see we've got a steady increase in the number of hospitals that are participating in this activity. We're not seeing a huge increase right now in the improvement area of it, but we're really excited to see that more hospitals are participating in this because we know that population health is a huge portion of what the flex program can be focusing on, and we love to see that there's more improvement here. Next slide. And this is one of the really fun things that we've gotten to see the past couple of years. So you can see here, each one of these colors goes from FY15 all the way up to FY20. Look at this giant jump between FY19 and FY20 in states that are participating, the number of EMS entities that are participating in flex EMS activities, right? So this isn't just the states. You can see that this is the number of entities, but between quality improvement and operational improvement, we've seen a huge jump in entities that are participating in flex activities. So we are very excited about that and hope that we can continue to get more people exposure to our funding, right? Next slide. And here's just a brief breakdown of the flex program spending, because the other part of your PIMS report that we're going to go into in a minute is not just which hospitals are participating, but where your dollars are going and how much money you're spending on each activity program area. So you can see the blue there is quality improvement, the red is financial improvement, and the darker blue goes to population health, then EMS, and you can see kind of how you break down your flex spending. Next slide. Okay. This is where this is going to get we're going to show a bunch of screenshots. We're going to talk about PIMS collection and how you get to report this in EHB. There are multiple other screenshots if you need them in the email that I sent out to all of you a couple of weeks ago. So you can reference that document if you need to. These slides will also be available in the future, but we're just going to walk through quickly what EHB is going to look like when you go to report your PIMS. And I will say your screen as recipients looks very different than what my screen in EHB as your project officer looks like. So if something isn't right, you may need to contact EHB help, and I have that information in here, rather than calling us as your project officers and saying, can you walk me through this? Because I won't be able to see the same things that you see, okay? So next slide. This is where you're gonna go. Your first thing, how do you find PIMS? You go into EHB, and then you go up here into grants, this top tab right here, and you'll say work on performance report. And then you click that. Next slide, Caleb. And here, this is the document. This is just a screen grab of the document I sent out to all of you with the data dictionary, what everything means, frequently asked questions, and instructions with more screenshots that you can see in there. One thing I just forgot to mention on the previous slide, Caleb, you don't need to go back to it, but I'll just tell you all, the due date on this is, we put it in your NOA, it's October 30th, but that's a Sunday. So I highly recommend that everyone get this completed by October 28th, which is a Friday, the last business day. And if possible, do it a few days before then, in case you run into any technical problems with EHB and you have to go into EHB help and fix something. We don't want you to get locked out of the submission. Next slide, please. Okay, so what you're going to see when you go into PIMS is you're going to see these 8 forms, and they're going to match the activity names that are going to match your work plan, right? So you'll see here over on the right, they match quality improvement, operational and financial improvement, population health, et cetera. Now, I want you to pay quick attention. These numbers right here do not match the program areas that are on your work plan, right? That's because the first page, and I'm going to show you a better screenshot in just a second, the first page of your PIMS is your selection page, where you choose which areas of your work plan you are participating in. So don't go by the number here, I would go by the name, all right? And this again is for any FY21 activities, so activities that were started on September 1st of 2021 and have gone into this year, August 31st of 2022. And that includes any FY20 funding that was approved as your carryover to spend into this year. And we're going to go into more detail into that in a second. So next slide, please. Okay, so here's what you do. Like I said, log into EHB, go to your performance reports and open PIMS. You're going to select the activities via checkbox, record individual hospital participation and improvement, record your program spending, save each page, mark complete. Okay. Now we're going to go through each one of those in more detail. Next slide. Okay. So here is what your PIMS is going to start looking like, your opening page. Okay. You're going to see your grant number in here. You're going to see the reporting period, all of these things. This is for a really old reporting period, so it's not going to match anything right now. One thing I want you to pay attention to when you log into your PIMS report is this red button right over here, this red number. Your session will expire in. The PIMS will time out in 20 minutes. So I highly recommend that you save your work frequently to make sure that it doesn't time you out. Next slide. Okay, like I said, here's where we're going to break down the structure. You're going to pick on your selection page which program areas you're working in, and then it's going to break it down by program area. All right, next slide. So right here, the first thing that you need to do, the easiest way to do this is to open up the quality improvement area, program area 1. The first and most important thing you need to do is check your list of hospitals. Make sure that the CCN number is still the same, nothing has changed, and make sure the name of the hospital has not changed. If either of those are incorrect, you won't be able to move forward and report this in the right way. So if something is different and not correct in your system, you need to let your project officer know, and we can update the name of the hospital. If it's changed, we can try and update the CCN number, all of those things. But just do a quick check on your hospitals first to make sure they all match. Next slide. Then this is a selection page where I said this is section 1, where you pick which activities you are participating in. So you'll see it all breaks down in order from 1.1 all the way down to program area 6 to figure out which program areas you're participating in. So there's one checkbox for each category. And I want to stress these categories should match your work plan. Okay. If you've got an activity or something in somewhere in your work plan that you were not able to do because of whatever reason, I'm going to go into that later, but you should still match your work plan as to what you submitted to FORHP in this selection page. Okay. The ones that are grayed out that you see here, 1.1 through 1.4 and 2.1, those are required. They're automatically going to be selected. You need to go in and select the other ones. Next slide. Now, this is where you enter the hospital data. So you see this list of hospitals right here, and you'll see participation and improvement, and you also see historical participation. This is going to get checked. Historical participation will be checked if it was listed as participating in an activity in FY20. And now in FY21, you can either check if it's still participating. If it's not, that's okay. And then you can also check whether or not you have improvement in that program area. And now, I think a lot of people tend to ask this, so we're going to talk about it. Next slide, as to what exactly meets the requirement for participation in the Flex program. Now, we have a lot of things that are in our Flex work plans that do not necessarily meet PIMS participation, and that's okay. I'm not telling you right now to get rid of them out of your work plans or anything like that. I'm just telling you, you don't need to report that in PIMS, okay? So you can see here in the blue on the left, the things that meet participation criteria in PIMS. So that's working towards a goal to improve MBQuip reporting, right? That is not just reporting an MBQuip alone. We're not going to ask you in PIMS to report anything that we can get from a different source. So if that's the case, like those MBQuip reports, we have that. We don't need you to report that a second time. We need something different than that, right? So are you having your your critical access hospitals, are they attending a 2-day team steps training, right? Or is it just going to one state rural health conference? If it's just the one rural health conference, that's not going to meet our PIMS participation, but participating in a 2-day training, participating in an HCAHPS quality improvement cohort, if you're meeting bi-monthly, things like that, those will meet your participation criteria. And Lisa, I see your question. If any of the information is incorrect, you submit it to your project officer, send them an email and tell them what it's listed as and what it should be, and then we can work to fix it. Next slide. So now here's the next big question. Many of you are probably asking, I have participation. I know who has actively participated in my activities. How do I know if I have improvement, right? So this is more about measuring an outcome. So did the participating critical access hospital improve the outcome that was the target of the activity? So if it's any change in a positive direction, right? So I want to say, if you don't have that information yet on whether or not someone has improved, that's perfectly okay. You don't need to say anything. You don't need to defend it. We know that sometimes measuring improvement takes time. So if you have no improvement, you can check the box that says participating and then just leave the box blank for improvement. That's perfectly fine. And I will say, if there is a hospital that's participating in multiple projects within one PIMS activity, they can show improvement in one to qualify for improvement, if that all makes sense. And if you want to discuss this a little bit more in detail with your project officers as to what that might mean, please feel free to send everyone an email. Next slide. Okay. Reminder, I just said this, we're going to repeat it. Historical participation is going to be checked if you previously reported that a CA participated in an activity in FY20. Now, again, that does not mean they must continue to participate in all further years. Maybe they have other reasons why they're not participating. That's perfectly fine. This is just a reminder of why that gray box will be checked, and you will not be able to change that. Okay, next slide. So again, these slides are going to be available for you on the TASC website, so you can come back and reference this, but I want to just point out a couple of sections that are going to have a different data entry, right? So you might be wondering, well, 2.1, that's our statewide financial assessment. I don't have specific CAs that are participating in that because that's statewide. We know that. So you're not actually going to check any boxes as far as hospitals go, right? You're just going to record your spending. Same would be for 4.1. You would just record your spending. 4.2 through 4.4, it's not asking about hospitals, it's asking about EMS entities, right? So again, read through all of this and read through the instructions that I emailed out. You can go back and reference these slides later, but this is just for you to look at later on to see, why does this screen look different than some of the other ones if it's one of these activity codes. Next slide. Okay. Here's where we're going to talk about spending. So we know a lot of times spending has to be an estimate, and that is okay, because we know that sometimes, especially when it comes to staff time, you're not necessarily sure how much has been spent, how much hasn't been spent, how much it breaks down. If, you know, Lisa Davis in Pennsylvania works on 3 different activity categories, how are you going to break that apart, right? We understand that. So this can just be an estimate. But I will say your total award, right up here for the current reporting period, and your approved carryover minus your unspent funds should equal your actual spending. Okay. So your carryover that we're talking about is specifically the amount from your FY20 award that you have been spending this year. And if you have any questions or concerns as to which carryover it is, how much is it, you can go back to your project officer and they have that information for you. So you're going to use this page to record your spending. This is going to calculate your actual spending as you estimate it, right? Next slide. Okay. So again, this is the breakdown a little bit for your the current report period, right? And your I can't even form a sentence today, and your carryover for this period, right? And then you need to break it down by program category. So you can see right here, this is already starting to break down. 1.1 patient safety. This estimate is $19,925. Same for 1.2. These, again, we can just use these as estimates if you don't have the full breakdown. And if there are any questions that your project officer reads, I can just email you and let you know. For spending, do we include direct plus estimated FTE allocated to that program area? Yes, Sarah, you do. Okay, next slide. Now here is one important thing. This is going to show you an error has occurred, okay? So this actual program spending for current report period is going to be automatically checked as to what you're listing in as you're spending along the way when you go through each page, right? If the numbers here are not equal, right, your flex funds used and your flex funds spent, if you entered in that you spent 551,000, right, but then according to all of the math, it's only showing up as 100,000, you're going to get an error. These two numbers should match. And again, if it needs to be an estimate, that's okay, but each section is going to grand total automatically. So when you get to the end of this, if it doesn't match, you're going to find an error somewhere. Okay, next slide. If you want a reminder of your total flex award for last year, and especially I know because right now we've just gotten out of NOA calls, you've gotten all of your notices of award, and there's an increase in the amount for this coming year. At the back of that document that I emailed out a couple of weeks ago, this Appendix C has a list of how much each state was given in flex awards for FY21. So go back and reference that. And again, reach out to your project officer if you have any questions. Next slide. Okay, next. These are some helpful reminders here. Again, your activity categories and your work plan should match each other, okay? Let's say, for example, you were doing an activity in 2.3 in financial improvement. It was in your work plan, you sent it in for your NCC, we've all approved it, and due to COVID, that activity never started. It never got kicked off the ground. That's perfectly fine. We understand that. What we want you to do is still check this box here in 2.3. This should match your work plan that you submitted to us. And then what you'll do, if you go to the next slide, Caleb, you're going to see this right here. Any comments about this form that you entered? And this is where under form for 2.3, you can say revenue cycle management did not happen due to COVID, you know, whatever the reasoning may be, but we still need a documentation that you allocated money there. It was not spent because of this reason. And you can put it all right here in this box in the comment section. Okay. The next important thing that you need to do is make sure that on each page you say, is this form complete? And you need to mark yes. And then if you have any additional documents to upload, you can. You are not required to upload any documents, but then make sure you hit save. And again, as a reminder, PIMS does time out after 20 minutes of inactivity. So I would highly recommend that you hit save as many times as you can. Next slide. Okay. When you finish each page, when you finish your whole quality improvement section, for example, and you've marked that document complete, like that box we just showed in the last slide, and you hit save, when you go back to your main page, you're going to see this green checkbox that says that this page is done. If you still see this yellow pencil that's next to it, that means it's not complete. You did not mark yes under complete, or you still have something missing. There was an error that populated. When you see this green checkbox, you know that page is ready to go. Next slide. You can also run prior PIMS reports if you want to. You can see them in a PDF version here, and it'll show you by program year which one it is. If you want to reference them for any reason, it'll be on the left-hand side under reports. Next slide. Okay, this is what I mean when I say you may need to contact EHB help. If there's anything that goes wrong as far as like technical issues, there's this website here that you can go to. There's a phone number right there. When you submit a request, they're going to give you a ticket number. When you get that ticket number, you can let me know what it is, but there may be a lot of things that we as your project officer cannot help you with because we don't have the same view on our EHB screens that you do. So get that ticket number, send it to me, and I can follow up with them, but you have to be the ones to submit it first. Next slide. Okay, now we've gotten through PIMS. We're gonna keep on rolling, and we'll save questions for the end because we're rocking and rolling right now. So after your PIMS report that's due in October, we all know the end of year report is due on November 30th. Next slide, Caleb. All right, this is going to be the same format as it was last year for anyone who filled this out last year. For those who did not and are new, this is basically a chance for us to get one full year's worth of data on how you've done in your programs, right? So what we need you to submit into EHB is a narrative report, including one significant accomplishment per program area and an updated work plan for all of your activities. And so it's just your regular work plan Excel spreadsheet that has that extra column in there that says completed outputs or something like that, right? Now, the narrative, when we say one significant accomplishment, we mean that per program area. So it should say that you are working in, right? It should say quality improvement. My significant accomplishment is this activity. The impact and the results were this. Our lessons learned and best practices are this. And we do or do not recommend this for other programs, right? And then you follow it up with program area 2, financial and operational improvement, and you repeat that process, right? These end of year reports are a really wonderful way, especially as we're highlighting your significant accomplishments, for us to kind of pull together really cool, fun stories and really wonderful things that you guys are doing in your flex programs that we get to share with all of our senior leadership. And it just makes it's a nice condensed way for us to find that information. So this is what those are two of the attachments that you're going to submit in EHB. Next slide. And for those who have FY19 EMS supplements that are ending this year, okay, next slide. This is not for the EMS supplements who just got their notices of award this year, right? These are the ones that are finishing. For any of the states that finished their projects, right, you have a final report that's due on November 30th. And you can see here what we need you to put in that report, right? So we need, oh, sorry, I'm getting distracted here reading through Talia's notes. So what we need is your findings for your project, your final work plan that includes your measures and your budget. We need some kind of an information on what your challenges were when you did this project, as well as the tips that you would give to someone if they wanted to implement this themselves, and how sustainable your project is, right? Now, for those who have submitted the right paperwork and have gotten a no-cost extension, if your projects are not finished, you're going to submit what we call an end of year report rather than a final report, and just give us a current status of where the project is right now and what is left to accomplish, along with the updated work plan, where the budget is at right now, what you still have left to spend, and what you're going to be achieving in the coming months. If anyone has any questions on the differences between those two reports, please reach out to Talia. You can always email her with any questions on what you need to include, what the difference between the reports is, anything like that. Next slide. And this year we have an extra attachment that we're going to have you submit, and that is the QIL evaluation spreadsheet. So for these quality improvement projects you've been working on, as an attachment in the same submission with your narrative and your work plan, we need you to submit an updated spreadsheet of what you submitted for the 6-month evaluation for the hospitals and clinics, right? So I'm going to be sending out an email this week with instructions, an updated version of the spreadsheet, and a version of the survey questions that you'll need to answer. That's all coming in the next couple of days. But the information on the 6-month spreadsheet that you submitted should, for the most part, match what you're submitting now at the end, right? If you have a hospital that dropped out of the project after you did your 6-month evaluation, that's fine. Please include the name of that and a note saying that they dropped out. If you have a hospital that started late and you did not submit them in your 6-month evaluation, that's fine. Go ahead and add them in and just make a note in there that says they started late and that's why they were not included. Again, that email is coming from us very shortly with further instructions, and you can reach back out to us with any other questions you may have. Next slide. Okay. I have done enough talking for the next few minutes. I will come back in just a moment, but I'm going to kick it over to Bria, who is our grants management specialist, and she's going to give a whole bunch of information on federal financial reports. Bria.
Thank you. Thank you so much. Good afternoon, everyone. Again, my name is Bria Haley. I'm a lead grants management specialist for the project in the Division of Office of Grants Management Operations. So today I'll just be going over the FFR and the FFR module. Next slide, please. Thank you. Okay, so as you know, recipients must submit an annual FFR. The report should reflect the cumulative reporting within the project period for the document. And as of October 1, 2020, all FFRs must be submitted through the payment management system, PMS. Next slide. Recipients who do not have access to payment management must submit a new access request. Here's the link. And recipients who currently have access to PMS and are submitting certifying the FFR on behalf of the organization should log into PMS and update their permissions to request access to the FFR module. Please note that the request can take up to 3 days to process. Sometimes it's sooner, but 3 days max. Next slide. Alrighty, so here we have a screenshot of the FFR workflow, just some basic information. So the history, the uploaded documents, all those things, you'll be able to access the FFR. And then in the prepared report, you have the pre-populated fields, which are the organization's name, the account number, sub-account, the recipient address. We used to use DUNS number, now we use the UEI numbers, and then you also have the EIN. Next slide. And then here we have the report frequency, the type, and the accounting. So the report type and the frequency of the report, those are pre-populated based on HRSA's requirements. And then the basis of accounting is you select that. It's either cash or accrual. And then the project period and the reporting end date are also pre-populated. Next slide. Alrighty, so for the transaction section of the FFR, 10A through C, they are captured in payment management. So it's going to reflect whatever is in payment management at that time. And then the cash receipts, which is also pre-populated, those are the drawdowns. The cash disbursements are the disbursements that were last reported in payment management, and then cash on hand is auto-calculated. Next slide. Okay, so then line 10D to 10H, this is the FFR transaction section, and these used to be reported in HRSA EHBs, but now they're reported in payment management. So the federal funds authorized, that is pre-populated based on the notice of award. And then the federal share of expenditures, that is entered by the recipient, and that should be the cumulative total for the grant document. And then the unliquidated obligations, those are costs that have been incurred but not yet paid out. And the unobligated balance is pre-populated based on the funds authorized minus the expenditures. And that's where we get the unobligated balance. Next slide. And then here we have the FFR remarks section. So if there's any issues with the FFRs, or if you intend to carry over funds, this is where you would put a note letting HRSA know that you intend to carry over. If you have any revisions to the previous FFR or anything that we should know, the remarks section will be the best way to communicate with us. So when we review the report, we'll have all the information captured in the system. And then you have the prepared by information, whoever's certifying the FFR, number, email address, and then the date that it was prepared. Next slide. Okay, so here's some basic payment management information. We have the Office of Operation. We have the federal holidays where payment management is closed. There's just the regular government holidays. And we also have the help desk number and the payment management email. Next slide. And then any questions related to the FFR or issues with certifying the FFR, you'll be able to submit them in the web portal, and payment management will be able to get back to you. If payment management cannot, you can reach out to me and I can see what I can do on our end. Next slide. Okay, thank you. And I'll turn it back over to Laura, and then we'll take questions at the end.
Thank you so much, Bria. So this slide right here is really just a summary of the slides that Bria was just talking about. Your FFR is due on January 30th of 2023. However, that is also a Sunday. So the last business day to do this is Friday, January 28th. Again, the same with PIMS. I kind of recommend this the same for anything that you have to do in EHB. We all know EHB is a little bit tricky sometimes. Even PMS can be a little bit tricky sometimes. So I would recommend making sure that you try and get this done at least a few days before Friday, January 28th, in case there are any technical issues. Now, I understand that for a lot of you on this call, you don't have anything to do with the FFR. Your finance departments have everything to do with it, and maybe you can't get them to do it early. I understand that. But even just a couple of days, just in case there's any technical issues, would be helpful. Now, there is one thing at the bottom of the FFR, there is a remarks section, and we need you to write in there whether or not you intend to carry over your unobligated balance. We're going to talk about carryovers in just a second. You are allowed to request a carryover of either the full unobligated balance or less than that, or you don't even have to request a carryover at all. So this is why we need you to write in that remarks section if you're planning to carry it over. If not, you'll need to resubmit the FFR. So again, there's links, there's a webinar in there for working in the payment management system. There's an FAQ page and just a repeat of that technical help desk in there for PMS. Next slide. Okay, now we're going to talk about carryovers, which is one of everybody's favorite and most confusing things to talk about. So your carryover approval requests are required to be submitted within 30 days of your FFR submission, right? So the final deadline is March 1st of 2023. Now, I highly recommend that if you can, you submit it before March 1st. At the very least, start having conversations with your project officer this fall, like even next month, if you can, as to what you may want to do with your carryover money, right? So if you have an unobligated balance, as I mentioned before, you have the option to carry over that funding into this current budget period to be spent by August 31st of 2023, okay? So you can carry over, or you can request, I should say, to carry over your entire unobligated balance, only a portion of it, or none of it at all. What we need you to submit in EHB, there's a video link here at the bottom. We'll need you to submit a prior approval request for a carryover. And you need 3 things to go in there. Your cover letter, and that's going to explain why you have an unobligated balance and what the plan is to spend down the funds by the end of FY22, so by August 31st of 2023 in the current budget period. And this is also going to talk about your plan a little bit, and you need to make sure that you mark this note right here. You cannot use carryover funding for new activities. You can use carryover funding to complete an activity that was delayed in your previous budget period, or to expand on an existing work plan activity in this budget period, but it cannot be used for a new activity. So after the cover letter, we need you to submit a budget justification for the carryover amount only that details how you're going to spend that money, right? Is it a contractor? Is it staff time? What are you doing with it? What deliverables are you hoping to accomplish? And exactly how that's being broken down. When the time comes, we're going to send out a bunch of examples and templates that you can use with all of the required information that we need. Now, the final document you need is the SF424A, and that form is no longer a separate document. It is built into EHB, so it's an electronic version, but that is a line item budget, again, helping us see how you're going to break down the spending for that carryover. Next slide. Okay, here's my helpful tips. And I'm going to give an example of something, and Bria can chime in and give a little bit more information if we need it. Reach out to your project officer early. And when I say early, I mean, like, you can start talking to me about it right now if you want to, okay? It takes a while for the finance departments to get the right numbers involved as to how much of an unobligated balance you have. It takes a while for you all to work on your program side, your contract side, to figure out what activities do you want to continue, what activities do you want to expand on, all of those things. But here is a breakdown. I want to give you an example. HRSA has 30 days from the date of your submission of your prior approval request for your carryover to issue a decision. Okay. Now, approval of a carryover request is not guaranteed. So that would be a conversation to have with your project officer. There may be other things, there may be negotiations that happen, but here's just a few examples of some timelines that I wanted you all to see, so you can see how long it might take to get your NOA with your carryover and when you can realistically start spending that money. So program A here did their initial submission into EHB on January 5th. They talked to their project officer ahead of time. All the documents are fine. There are no changes that we need to request on our end in the documents, right? So that means I can send it over to Bria. Bria can approve it, and they get their NOA by February 1st. And they have from February all the way through the end of August to spend that money. Same for program B here. They submitted it February 15th. 30 days later, March 15th is when they get their NOA, right? Now you can see program C, D, and E are all submitting their carryover requests right about the same time. Yeah. Now program C and D here, we had to request changes. So that timeline of 30 days will start over on the second part of the submission if we have to return it for changes, right? So program C can submit it at the end of February. And if I'm the project officer, March 1st, I go in and I say, hey, I'm so sorry, but you forgot to include your budget justification. And I had to send it back to you. And then you upload that budget justification. You don't get it back to me until March 6th. That means that 30-day clock starts over, and they may not get their approval until April 6th, right? Same for program D here. If they have to get the program, or they need to get more changes made in their documents, they don't get that second submission back to us with those changes until March 9th. They may not end up with their NOA until April 9th. But this program E, even though they may have submitted their carryover request after program C here, a day later, we didn't need to ask any changes. They had all the documents they needed. Everything was squared away. We can get that NOA out April 1st, right? Everything goes in a queue. And if the timeline has to start over, you go at the back of the queue when it comes to be submitted. So my best piece of advice is to please start reaching out to your project officer early to figure out what you may want to spend this money on and the information that we may need from you. Next slide. Or I should say, before I do that, Bria, did I miss anything on carryover requests?
No, that was perfect. Just it's like you said, it's really important to get started early, just in case we have changes, there's questions, and there are a lot of grants. So it takes time for everything to go through the system.
Awesome. Thank you so much, Bria. Okay, Caleb, next slide. Here's just a quick reminder. I know Caroline posted in the chat the link to who our project officers are, but if you need another reminder, here is the map right here with the breakdown of which states we all work with. Next slide. And here's all of our contact information, which all of you I do believe have. And that is it. So we still have a good 20 minutes left. And I know I just word vomited a lot of information at all of you. Does anybody have any questions for me, for Bria, on FFRs, PIMS, anything?
Hey, a good piece of advice may be if you're sitting here right now thinking that you might have carryover or you already know, is before this hour is even up, you already had it blocked out on your calendar. It's to schedule a calendar appointment to email your project officer. Just go ahead and put it on your calendar for next week or the week after. And that way it reminds you to go ahead and reach out to them with and about carryover stuff. So you're not behind, you're ahead of the game, and the conversation has been happening. I do that often. I'll put calendar reminders for something like that on my calendar. So it's a pretty good habit to get into.
That's a great idea, Matt. I put a lot of calendar reminders on. Email this person. I have it on my list every day. And we are always open to, even if you just have some questions about, we think we have carryover from this, I don't know how much yet. Is this activity a good idea? Is this activity allowed? And we can just kind of talk through that with you and brainstorm a little bit as to what's in your current work plan, what might be allowed. So yeah, you can always just shoot us an email and we'll set up a phone call if you just want to talk through some things too. Are there any questions on the end of year report? Oh, I see Stephanie unmuted.
Oh, yeah. Well, one of the things that I always struggle with is what's an activity that's worthy of capturing participation and improvement.
Mm-hmm.
So, you know, like the State Office of Rural Health Conference attendance isn't worthy, but a 2-day training is worthy. And some of the webinars that we provide give some really specific support. But by virtue of it being a webinar, I don't know if that means that it's not worthy. Is that something we should just have one-off conversations with our project officers about?
I think for specifics, yes, you can ask your project officer. I typically tend to think of like, if the webinar is something that has them implementing an activity, then that would be worthy of requiring participation in PIMS, right? If it's just like a one-off webinar that doesn't require a lot of other things, they're coming and sitting for an hour and that's it, then that maybe wouldn't. But we can kind of get into specifics one-on-one. Does that make sense?
Yeah, I think so. But if you measure knowledge change, like a pre and post assessment, and you're able to document that there was some sort of a change in that regard, would that count, or is it more because it's a simple sort of 1 hour passive opportunity? Is it more the engagement piece that you're looking for when you're looking at what you're measuring?
No, I think if you've got a measure of knowledge gain, then you can definitely report that.
Okay. All right. Thank you.
Mm-hmm. Anything else?
Okay, I'll ask one more question.
Please keep going.
So just to confirm, on the QIL report,
yes,
for the spreadsheet that we will be submitting also through the EHB, did I understand correctly that that template would be provided in the email that we should be anticipating in the coming days? Is that what
yes.
I understood?
Mm-hmm. Yep.
Okay. Okay, thank you.
Yep, that should be coming by the end of this week. And again, that email is also going to have it'll have the spreadsheet in there for you to update, but it also will have a copy of it's a PDF version of the questions that are going to get asked in an online survey, just like you did for the 6-month evaluation. This is just a version you can read through beforehand before you click into the online link if you want to read through it, as well as instructions for everything. I think Megan Lahr might be on the call right now. Megan, is there anything we missed on that QIL spreadsheet that you want to make sure we talk about?
No, I think you got it all, Laura, but happy to answer questions if anyone has anything else.
Awesome, thanks.
I have a feeling that the silence is probably just folks being overwhelmed with the SHIP FY23 NOA, the REH documentation, the PIMS end of the year report. I think it's probably just a lot, but we can always use the forum if we have other questions that we don't think of right now, right? As far as,
absolutely. I'm sure not between SHIP and REH and everything going on. I mean, even if it was just this one webinar, I dumped a lot of information at you. So yes, I understand it's overwhelming. You can email us at any time with further questions and we can go back over it if we need to.
Yeah, the forum is a good opportunity for that, as well as task@ruralcenter.org. And the benefit of that email address is it does not matter what the question is or what it relates to. That is the best single email address to know, because we can triage that email to the project officer if it's a project officer specific question, or to our KEDA or to the SHIP folks. Whatever questions you have, please do, and I'll put that in the chat box, but please don't hesitate to ask us and we can help connect you with people. Michelle, I see your hands up.
I have an IHS facility that just became a critical access hospital in May. So should they be added to that list of hospitals, but they didn't participate in anything for this year? I expect them more to be next year.
Then let me double check. My initial thought is that they don't need to be added until next year when you need to record their participation, but I'm going to double check that answer for you. Okay.
Okay.
All right, guys, what other questions do we have related to PIMS, end of year reports, FFR reports? All right, so as Laura mentioned, we will make these slides available. We are recording the call, so the slides, the webinar, the recording from the presentation, all will be made available shortly. In the meantime, if you do have any questions, please don't hesitate to reach out to us at TASC or to your project officer directly with any questions. task@ruralcenter.org is the best way to get a hold of us. And thanks, guys. Have a nice day. Let us know if you have any questions.
Thanks, everyone. And if anyone's going to Kansas City next week for NRHA, we will see you there.
Yeah, see you there. Thanks, guys.